Good morning, everyone. I am Amanda Slater, and I am an Assistant Deputy Director for the Utah Department of Health and Human Services. Excited to be saying that we are officially the Utah Department of Health and Human Services. Wanted to welcome everyone to this call today. For any of you that are new on this call, this is a quarterly online provider meeting. Each of our division representatives will provide any updates or information they have, and then we will go ahead and open for your questions. Feel free to add any questions in the chat at any time, and we'll get to those at the end. Also, before we start today, we do want to perform a couple of Zoom polls. The questions in the polls will just help us tailor these meetings to better meet the provider needs. So please answer those. And that would be great. And then I'll just start with a few merger updates. As I said, July 1, we are officially the Department of Health and Human Services. That was as a result of House Bill 365 in the 2021 general session. We have now officially became one agency, and we are the largest state agency that serves Utahns. Through our thousands of employees, partners like all of you, members of the public participating in meetings, providing input, we were able to work alongside all of you to gather, evaluate, inform, and align the elements of our department to best serve the people of Utah. This consolidation process has allowed us to identify challenges and barriers to accessing care for people in need, but also provide the opportunities to unify services, reduce redundancies, improve equity, and offer more efficient services. We're looking forward to this consolidation and the additional resources that we may provide statewide. Additionally, since this is our first call since the official merger, each of our division staff will share some key updates about the consolidation as far as how it will affect or may alter the way that you currently work with them. Additionally, as I said before, at any time during the meeting, you can enter your questions in the chat. We will do our best to answer all of the questions during the meeting, but if we're not able to, we will get back to you. Additionally, you can submit any questions prior to the meeting through submitting them through our email, which will be dropped in the chat for you all. We want to make sure that we're able to answer these questions as accurately as possible. And then with the email, you'll see that it's now the CQI email. I know a lot of you are previously aware of the OQD email. Shannon Toman Black will discuss that change in her update. Okay, a couple other just general announcements that we wanted to provide for you all. Starting August 1st, the DHHS telehealth platform will be changing to Zoom. So users that are currently using the telehealth platform and have hosted a call within the last 90 days will automatically be moved to the new Zoom platform. The report is going to be ran for active users on July 15th. So if you have used it in the last 90 days, then we will move you to the Zoom. We will have a limited number of telehealth licenses for our contracted provider network. These licenses will be awarded on a first come, first served basis. Providers who do not take advantage of the opportunity will need to fund their own telehealth platform after that. DHHS will monitor the licenses to ensure that they are being effectively utilized, and will notify you. Additionally, existing users that have not used the current system in the last 90 days but need a Zoom account will be required to submit a new copy of the updated DHHS telehealth third-party agreement form. And the new users, those will be submitted through our website that we'll drop in the email as well. You can request those forms through that email also. We will need those by August 1st. And then any existing DHHS Telehealth Utah account IDs will allow users to access the new telehealth Zoom platform. You will not have to create any new accounts. The new website URL will be shared once we begin moving over those new accounts. The current platform for telehealth will not be accessible after August 1st. Any existing scheduled appointments will need to be rescheduled once you have access to the new DHHS Telehealth Zoom. Please make sure that as you use these telehealth platforms, if you have your own, that you are using a HIPAA compliant telehealth platform, as we do plan to include a review of this requirement during our audit process. So that's some updates about our telehealth. Wanted to throw just a couple more updates. As for those of you that have been on this call often, you will know that we've been giving a lot of COVID updates for the last 2 years. Wanted to just update that now as we have transitioned to the steady state, we are recommending that communities and individuals should just begin to follow the Center for Medicare and Medicaid COVID-19 community levels to guide decision making. We will update you if anything in Utah's status has changed. If you have any questions regarding the COVID, please reach out to us. We will or drop a link in the chat for the COVID-19 report of the steady state. And then just one more update. You should have received several emails of this, but we wanted to just give a last minute reminder. As it is the end of the fiscal year, today is the last day to submit any billing forms for services provided between July 1, 2021 and June 30th, 2022. Please get those submitted by the end of business today. If you have any payment concerns, please work with your division finance staff for resolution. So that was a lot of updates for me. I am going to go ahead and shift over to our operational unit updates. So I will go ahead and turn that over to Shannon.
Thanks, Amanda. Some of you have already been introduced to me, but I am Shannon Toman Black. I am the Division Director for the Continuous Quality and Improvement Division in Department of Health and Human Services. So just some operational updates for clarity. The Office of Quality and Design no longer exists. The functions of that office have been split between 2 new operational units. The Continuous Quality and Improvement contains the Office of Service Review, which has the functions of the Quality Management Team, Internal Service Review, Fatality Review, and related parties investigations, or you may know them also as conflict investigations. Carrie Bambro has been named the Director for the Office of Service Review, and her email will be dropped into the chat. She will retain that point of contact. Most of you have been working with her already in that capacity. Jessica Hooper is managing the quality management team now, and she reports directly to Carrie. And then Chandler Mintier, which some of you may have worked in the past, is managing the service review team. Just for awareness, the division also contains the Office of Service Review, which is the office director is Dean Whedon. And that office handles DHHS's internal quality support. So you likely will not have much interaction with that office, if at all. Beyond that, we don't really have any updates for this. Just wanted to ensure that you all were aware of those structural changes. And I think Kim Kettle will talk a little bit more about the pieces the functions that were in Office of Quality and Design that are now in her office. So that is it for continuous quality improvement. Happy to for you guys to reach out or to answer any questions.
Thank you, Shannon. I will go ahead and turn it over to Leslie with DCFS.
Thanks, Amanda. Yeah, I just wanted to touch on a couple of points. Our agency, DCFS, we have felt like this merger has actually gone pretty smoothly, and that the agencies and all of the changes involved, it feels like it's been very supportive, and hopefully that's coming across with any interactions we're having with you as well. A few chaotic moments, but nothing that hasn't been insurmountable. We will maintain our name. We're still the DCFS you know and love. We have not had any major internal leadership changes or structural changes at this point. Sometimes in our regions, they might make some changes. And then hopefully just as providers, when they're working with you, you may be made aware of those as they might impact you. I did want to add, because we just found this out today, we did finally get our new ICWA administrator hired. It used to be Elisa Lee, and she left in March. And I believe the new gentleman they hired is Jamie Harvey. So we're excited to have that representation back on board. It's sorely needed. So let us know if you have questions there. And then just to wrap up, I'm still your contact person for any provider questions or concerns related to DCFS. And if I can't answer them, I'll ensure we get you to the right person who can.
Thank you, Leslie. Thank you. I am going to jump in again. Fortunately, JJYS was not able to make it today, so I'll just provide a couple of their updates. So the first update, just with the merger, I think most of them know them previously, is JJS. They have updated to Juvenile Justice and Youth Services, so JJYS, just to align better with what they're providing. And so that's exciting new change. There's also been a couple changes in leadership we just wanted to update you all about. Most of you may have heard that Donovan Bergstrom has actually moved as the division director for the division of customer experience in the new DHHS. So Trina Dickerson has replaced him over the detentions and youth service centers. Her email will be in the chat. And then also many of you are aware Mike Bukovich retired. And so Jill McKinley has replaced him over secure facilities. And again, we will add that email address in the chat so you have that. So those are the updates for JJYS. I will go ahead and turn that over to Chanel.
Thank you. So a couple of changes. So for the Division of Substance Use and Mental Health, it is now going to be called the Office of Substance Use and Mental Health. So awesome is our little acronym, which we love. And then also just an update on Senate Bill 179. For our providers, it removed the requirement for agencies to receive be certified as JRI providers in order to provide individuals treatment services that were involved with the criminal justice system. So that certification requirement no longer exists. So any provider that is licensed with the Office of Licensing can provide services to individuals involved with the justice system. They do not need to be certified as a JRI certified provider. If you do have questions on that, Thomas Dunford with our office can still respond to any questions that providers may have for that. He's still over those services. And then just a couple of updates in leadership. They're not new changes. They've just occurred kind of during this merger time. So just an update. Doug Thomas was our director for the Division of Substance Use and Mental Health. He has moved on and is working for a new employer. Brent Kelsey was one of our assistant directors. He has been moved up and named as the director for the Office of Substance Use and Mental Health. And then Eric Tadahara is an assistant director over some mental health and substance use services. And then Amanda Alkema is working with our mental health as an assistant director, and she's also working with the state hospital. So those email addresses and contacts will be added in the chat if you have any questions, but that's the update for the Office of Substance Use and Mental Health.
Thank you, Chanel. I will go ahead and turn it over to Jamie.
Thank you. So let's see, sorry, I'm not where I need to be. as far as changes for DSPD, right now we're now under the Healthcare Administration, so we're with Aging and Adult Services. Not much else has changed. USDC is still a part of DSPD. They have had no administrative changes. We haven't had any name changes and no real changes to our administration. But there are a couple of things I wanted to talk about outside of that. I do this every time we meet, but I just want to continue to encourage providers to look at the contract for the limited supports waiver, because we need people signing up for that contract, and we'll put the link in the chat. If you can just take a look at it and see what services are in there and the rates, it may be just something that you've missed, but again, just really encouraging providers to participate in that waiver. And then the other thing I wanted to bring up is we're looking at potentially piloting a program. It's called LEAP. It's Leadership and Empowerment Abuse Prevention. This is run out of Virginia, and we're talking about piloting it in Utah. But what it would do is certify LEAP trainers to help educate people with disabilities about safe relationships. The training program would be one person and with a disability and one without. And the training would be at no cost because we're accessing a grant to do that. So if you have any interest at all in becoming a trainer or want to know more about it, just email me directly and we'll put my email in the chat as well. And then the last thing I wanted to talk about is our housing table talk, just to remind you that that is happening September 28th at 10 a.m. If you have questions about housing or about the table talk and participating in that, you can contact Camille Bowen or Mandy, and we'll put both of their emails in the chat as well. And that is all that I have.
Thank you, Jamie. Sorry for the delay there. Couldn't find my mute button. I'll go ahead and turn that over to Joseph.
Thanks, Amanda. And similar to Jamie's updates, ours revolve primarily around name changes and just where we fall under the new umbrella as well. The Division of Medicaid and Health Financing is also now part of the Division of Integrated Healthcare. We are now combined with the Office of Substance Use and Mental Health and the state hospital. This division is also under the Healthcare Administration section, along with DSPD, Aging and Adult Services, and the State Developmental Center. Any of the former bureaus that you were familiar with are now called offices, but still retain very similar names and still do the same functions. And we continue to report through the Medicaid director, Jennifer Strohecker. So the purpose of our work still remains the same. We do operate 3 of the home and community-based waivers internally, and then we also coordinate with DSPD and Aging and Adult Services to help with waiver coordination and any of our federal reporting.
Thank you, Joseph. I will go ahead and turn it over to Carmen.
Welcome, everybody. I'm Carmen Richens, and I am the interim director for the Office of Licensing and Background Checks with the new Department of Health, the Division of Health and Human Services Department. The offices are a little bit merged. With Health, there was an Office of Licensing, and with Human Services, there's the Office of Licensing, and we brought those 2 components together. And then we also pulled the background screening out of the Office of Licensing at Human Services and joined it with the background screening from Health. So we now have 2 departments in this division that do those 2 different functions, kind of overlapping with other areas, but a lot of functions they do the same. Being the interim director, I'm only in this position a couple of weeks, so I'm learning a lot, and these kinds of meetings help me with that, so I appreciate that. We also have a new director over the Office of Licensing, which is Simone, and he's going to talk to you in just a minute. Our contact information does need to be put in the chat. We're doing all of the same things, just in different names. So welcome to reach out to us and we can help you. Simone is the permanent director of the Office of Licensing, so he should be around for a while. We're going to post our new org chart on the website. It just went out today to our staff, so that'll be posted today. And again, the assignments remain the same. Your inspector should remain the same. Everything should remain the same with the Office of Licensing and with background screening. Your contacts are still the same. We're just kind of juggled around with supervision. So, and with that, I will turn it over to Simone.
Thank you, Carmen. Good afternoon. Well, as Carmen said, I'm new to the Office of Licensing, not new to licensing. I have 13 years of experience working with background checks, with investigations, with complaints, with licensing, and I am happy to join this group and to be working with all of you. We want to make sure that this work is done as a team. We need the provider's information and your feedback to be able to make decisions that are coming up in the future. We're working really hard to make sure that we have combined protocols and practices that are going to assist providers. We're also working on the rules and clarification of the rules that are needed at this time for alignment of terminology and some other needed changes, such as the transport company for youth. Some of these changes were not able to be submitted right away because of the merger. We needed our finance team to create some fees and some other changes here and there. But pay attention to the announcement that will come your way so you can give us comments on the changes and so we can get this process through. Again, I want us to become a team and work together so we can protect the health and safety of these vulnerable populations that we are working for together. Thank you.
Thank you, Simone. I will go ahead and turn the time over to Marion.
Hi, I am covering for Kim for the Office of Coordinated Care and Regional Supports today. We just wanted to let everyone know that the service navigation team is getting ready to set up some provider fairs throughout the state. And just a heads up to watch for a survey that's going to be emailed within the next week. We want to just gather information to help us identify ideal locations and providers that are interested and their availability. And that's it.
Thank you, Marion. Emma, I'll go ahead and turn it over to you.
Hello, the communications office is not now in the merger known as the Office of Public Affairs and Education. Our acronym is OPAE. We do provide all of the same services for both, health and human services, internal and external. So we stay the same, but got a little bit different name.
Thank you, Emma. I appreciate that. So that are our updates for today. So we'll start the question and answer period. Please enter any of your questions in the chat and we will try to answer those. If we're not able to answer them today, we will get back to you as soon as possible. Additionally, I just wanted to say that you can go ahead and answer any questions of your division representatives. They don't have to be questions just related to today's updates. So again, feel free to do that. I'm going to go ahead and I'm going to shoot the first question to you, Shannon, if you don't mind. The question is, does OSR do CPS investigations of providers? Oh, Shannon, I don't think we can hear you.
Thank you. I'm trying to hit the space bar so it does the temporary unmute, but it's just really on and off for me. So I appreciate you letting me know. So the question is, does Office of Service Review do the Child Protective Service investigations of providers? And that answer is yes. That is the related parties investigation team within the Office of Service Review. Again, also known as the conflict investigations team. So yeah, absolutely.
Thank you, Shannon. Next question I'm going to kick to Jamie. It looks like it's actually a couple questions in one, so I'll ask them together and let you answer them. The first one is, who is the best contact for the limited supports waiver? You've sent in docs multiple times and have never heard back. An additional one says, we've attempted to send solicitation documents for limited support waivers to Becky Dalby. Is that the correct contact information for her? If not, can we please find out where they would be sent to?
Thanks, Amanda. And I'm glad I have the opportunity to speak about this again, because I did hear from Emily Goff that there may have been some information that's still being worked on. So yes, Becky Dalby is the right contact, and I believe the email that was in the chat is correct. One thing that I would encourage you to do, though, is to CC Emily Goff if you send anything in, or you're welcome to reach out to her directly if you have any problem submitting anything.
Thank you, Jamie. Let me go. I'm going to throw a question to, it looks like it was kind of answered in the chat, but just so that everyone hears it, I'm going to throw a question to, I don't know, Carmen or Simone or Janice from licensing, which one of you want to answer this, but there was a question for clarification regarding the new code of conduct. They were asking if the new form with the licensing code of conduct replaces the previous DSPD ones and Office of Licensing ones.
I can jump on that one just because I was part of the creation, so I'm aware of it. Yeah, we consolidated all of the different floating around there codes of conduct in an effort to streamline, and we finally got it done, and it is in effect. So that one that was linked in the chat that has the DHS branding on it is the one that is currently in effect. You can find it on the Office of Licensing website if you need it. It's hslic@utah.gov. We will be rebranding it to reflect the Health and Human Services branding, but the content will remain the same. So it is in use until it gets updated.
Thank you, Janice. Let me throw, there is another, looks like licensing question. So who does the DSPD contract review? Does the OL core review and the DSPD contract review get done together from now on? I've got total, or I'm confused as to who does what. I'm not sure who, Carmen, do you want to take that question?
Well, I do not know the answer. I was kind of hoping Janice would chime in. This might be one of those that we need to get back exactly. Oh, I see. ORS, all right, I got it. I'll read it. Thank you, guys. ORS completes the DSPD contract review. The guidance that was issued for OL OQD joint reviews is still in place until further notice, and OL and CQI/OSR staff will continue to conduct the annual jointly reviews.
I'm sorry, could you not use the acronyms and maybe just say it out loud, because I don't know what you just said.
Say that because I understood all of them. Janice, I'm going to ask, please.
Okay, Carmen,
Oh my gosh, I'm so sorry. Go ahead, Shannon.
Sorry, Janice, I was just going to say, if I'm happy to do it as well. I was going to tell Carmen she was going in and out, so I wasn't sure if anyone heard. So Amanda, just point to somebody, we'll do it.
Go ahead, Shannon. I'll let you take it. You know.
Right. Okay. So the Office of Service Review, which is in the Continuous Quality and Improvement Division, will complete the division services for people with disability contract reviews. The guidance that was initially issued for Office of Licensing and Office of Quality Design joint reviews is still in place until further notice. And the Office of Licensing and the Office of Service Review staff will continue to conduct those annual reviews jointly until further notice.
Thank you, Shannon. So there is a question. And Carmen, I'm kind of putting you on the spot here, so I apologize for that, Carmen and Simone. I'll let you guys decide. What resources do providers have if their concerns are not being addressed by state licensing agencies, or if they are feeling they are being targeted? There was an ombudsman approved, but how is this impartial if it is funded by state agencies?
I'll take a swing at that one, but Simone, you can chime in if you'd like to. Basically, we would appreciate you reaching out to us if you have concerns specifically with feeling targeted by any of the licensing staff. Education and training is being provided continually for our groups, but we also want to hear from you. I would encourage you to reach out to your inspector first, and if there's a concern, then you need to go up the chain of command. Simone is the licensing director, and so that'd be a good place to start. And if you still feel like you're not being heard, you're welcome to reach out to me and we could have a conversation and go from there. Simone, you have anything to add?
Thank you, Carmen. You are very accurate. I just want providers to know that we're working on addressing this process to make it simpler, so it doesn't look like every time you have a concern or you disagree with any of our decisions that you need to hire a lawyer. We're working on informal conversations, as Carmen said, through the chain of command. So you have several options to talk. Skip if you want either one of us, but talk to us and together come up with a conversation and a solution to the circumstances, so we all can learn together and avoid the day in court for anyone.
Thank you, Simone and Carmen. All right. Let me find another question here. Jamie, I'm going to kind of throw you on the carpet here a little bit. For DSPD, does anyone know when the massage therapy contracts will be available in the person-centered support plans?
That is something I'm going to have to get back to you on.
Thanks, Jamie. All right, let's see, next question. Let's see if we've got any other questions. Sorry, we're trying to get the answers to these questions that are coming in on the chat here. I am going to go ahead and ask a licensing question, and I'm happy to help them answer it because I know Carmen and Simone are new. What is the Office of Licensing's plan regarding COVID reporting? The state has moved to steady state on March 3rd or 30th with no updated directions. Families and guardians are beyond frustrated with the ease of the rest of the population are given, yet individuals are held to greater restrictions due to congregate care.
I'll take a stab at it. So this is general. The answer that I'm going to give you is general, but we will make sure that we send you information specific to your programs, just to clarify restrictions or recommendations given in the past. So as you have said, whoever placed the question, the state has moved to a more general management of COVID. Everyone, depending on where you are located, is to follow your local restrictions or mandates. So if there are any local mandates and requirements, you are to follow them. However, we highly recommend the use of masks, the practices, cleaning practices, hand washing procedures, and all those practices, not only to protect you against COVID, but any other communicable disease. One of the requirements for any facility is also to report any outbreaks to their local health department. That has not changed. That will continue to be the practice. So make sure that you communicate with your local health department and follow their instructions. Again, we'll give you more updates for the individual requirements for your facilities, but this is in general for every facility to follow cleaning, hand washing, and other practices that will help you protect your populations.
Thank you, Simone. And I saw there was a follow-up question about reporting to the Office of Licensing. Currently, and for as long as I am aware of, reporting of infectious disease outbreaks within facilities has always been a required critical incident. So you do have to report that to the Office of Licensing. I know that got very heightened in COVID times. So previously, you know, we didn't have very many infectious disease outbreaks, but that is a reportable incident for a critical incident. So you will need to continue to report those to the Office of Licensing. All right, let me see.
I can take the follow-up question on the chat if you want me to.
Perfect, go ahead.
So an outbreak now is the same as an outbreak in the past. So if 2 or more individuals are ill with the same communicable disease, that's considered an outbreak. So remember that the mandate to communicate to the Office of Licensing is with communicable diseases, not just a cold or any simple disease, but communicable diseases are the ones that are to be reported. And an outbreak is 2 people or more.
Okay, it looks like there's one more follow-up question on here that says, do you want the COVID outbreaks reported on the critical incident form or through the COVID incident report form, or both? I have not spoke to Carmen or Simone about this since they stepped into their role, so I am going to answer, and if they disagree with me, I will let them speak up on that. You can go ahead and just submit that through the COVID incident report form we created. It's more specific with the questions that we need to know for the COVID outbreaks versus a regular critical incident. If that does change, we would update you and notify you, but for now, I think you can continue to use the COVID incident report form. There's no reason to do it both.
I have been working with COVID so long that if you want me to, I can answer these questions. Is that okay? So just follow your formal protocol for situations with COVID-19. We will highly recommend to still check for fever, for coughing, for all those symptoms. We're not requiring it, but we highly recommend that you continue to do that and follow your facility protocols for individuals who are tested positive. And again, communicate with your local health department. They have protocols in place to guide you through, to tell you if you need to close a room or the facility or to do a deep clean of the facility. They will give you specific information on how to proceed when this happens. Because we cannot refer to one single incident in general and give you an answer that applies to every case, because there are possible exposure, there are exposures, there are positive tests, there are false positive tests. So there are multiple cases, but the local health department will give you a more accurate answer depending on the circumstances. And reporting, Amanda, I totally agree with you, but just providers, just so you know, as long as you report, we're not going to penalize you because you chose the wrong way to report. Just report, and we'll make sure to clarify what needs to be done or how the report needs to be done.
Thank you, Simone. I appreciate that. Well, I will give licensing a break for a minute, and I will throw a question over to Leslie. Do DCFS paybacks for this fiscal year need to be completed by today as well?
Yes, the answer is yes. I just double checked with our fiscal director on that.
Thank you, Leslie. All right. I'm gonna kick it back to you, Simone, again. Does a provider need to report a single staff testing positive for COVID?
Again, just follow the processes for critical incidents, and we'll give you more clarification on that, because it all depends. Again, COVID is a communicable disease, okay? Whether it is one person or two people or more will be an outbreak, but one person will be a communicable disease. So we'll give you more information on how we're going to be handling COVID-19 issues. It is still a problem, so let's not dismiss it, even though the Department of Health, well, previously Department of Health and the local health departments are delegating this more and more to the community and to the hospitals. It is still an issue, and it needs to be taken care of and be careful with. But we'll give you more information about it.
Thank you, Simone. I appreciate that. Okay. Okay, so I'm going to kick another question to licensing while we're waiting for some others. It says, when will these more clarifications be shared? We're struggling to manage operations while complying with the rules. Do we know, Simone, you said that we could give more clarification. I know that there is a CMS guide that recommends congregate care setting guidance that we're referring to. We've previously had a COVID guidance on the licensing website. So I'm assuming we could update it and put it on that website, but I'll let Simone, if you want to kind of clarify how we could give them more guidance.
Well, that's one way. Thank you, Amanda. Yes, all the guidance that, please know that COVID-19 was very unknown to everyone, the way it was going to develop and everything. And we created guidance as with the knowledge that we had at that time. We need to update that guidance, but we also need to send communication to everyone to let them know where to find the current guidance and what the current guidance is. So we might do it through emailing providers as well to let them know. At the same time, we're going to train our staff to know what the answers are. So if you want to call and ask us, we can have a united answer to everything. We're updating our program as we go as well.
Perfect. And since you were talking, Simone, I just went ahead and I dropped the link to the licensing website that does have the provider COVID-19 FAQ with that guidance. And so when we get that updated, we can get that posted there. So everyone has that link. All right. Let's see, next question. Looks like we've got a question seeking clarification on the 1-to-4 ratio in residential treatment. Does this mean 1-to-4 on shift or 1-to-4 at any given time? For example, if 2 staff are with 8 kids and 1 staff needs to go to the bathroom, is the expectation that the 3rd staff would be available to take the student to the bathroom, or is it okay for one of the 2 staff to take them to the bathroom and return when the student is done? I don't know, Simone, if you want to take that, or
yeah,
Janice?
I'll take it. Okay. And Janice can correct me as I move along with the answer. But this is related to direct supervision, right? So it is 1-to-4. And of course, if there is a student that needs to go to the restroom, direct supervision means that the staff supervising them is in physical proximity and actively supervising the individuals. So if they can make sure that the child or the individual going to the bathroom goes and comes back, then they are considered close enough to supervise. So they don't need to add another staff at that moment. And so they need to make sure that whatever the situation is for the child to leave, they are in direct supervision of that child. If they lose supervision of that child, that changes the situation. So 1 to 4 is not just during the shift, is for the amount of individuals that they are providing direct supervision.
Perfect. Thank you, Simone. It looks like that we have answered all of the questions today. So I will give it just a moment to let any other questions that come up. Okay, and I see that there is a question, and Emma, I'm probably going to need your help because I don't know the website off of my top of my head, but it says, is there a link that lists all of the names, titles, and divisions and how those have been broken out? We do have a new DHHS website that would have that information, and I'm blanking at what that is. Emma, I'm hoping you could drop that in the chat for us.
Yes, I'm looking it up right now.
Perfect. Thank you so much. Let's see. What other questions do we have here? Who does the DSPD contract review? Does OL do the core review and then the DSPD contract review gets done together from now on? I believe we already answered that question previously when we talked about the OSR core review. Shannon, do you want to grab that one?
Yes, I would love to. Thanks. So the Office of Service Review will complete the DSPD contract review. The guidance that was issued for Office of Licensing and then previously OPD joint reviews is still in place until further notice. And so Office of Service Review and Office of Licensing will continue to conduct the annual reviews jointly until further notice.
Perfect. Thank you, Shannon. And then I will go ahead and it looks like there's been a couple questions about the community guidance of COVID and that it has been changed, and are we going to, I'm summarizing this, and that we need something new as providers. We are recommending that we follow the CMS guidelines, and so that is the information we will be sharing with all of you. As Simone mentioned, we can get that updated on that provider website and also follow up in an email if needed. Let's see here. There was one more question coming in. Let me find that. A follow-up question to the 1 to 4. Would it be best to go together on scenarios beyond the bathroom one given to better understand how to, so if you want to go ahead and answer, to better understand how to logistically do it. Simone, do you want to answer that?
Sure. I bet for ratios and supervisions, there will be 1,000 different situations, and we won't be able to address them all in one call. So please feel free to talk to your licensor and explain your specific situation and the example that you have. You can contact me or Carmen or anyone or Janice and explain what the situation is. You can talk to any of the managers, Travis, John, Dustin. And if they don't have an answer, we normally bring it to the team and discuss it and address it, and then we'll give you the answer. We have not seen it all, and we expect to see new things every time. So let us know what the specific case, and we'll let you know if this meets the 1 to 4 or not. But all in all, make sure that you have the ratio, that you have at least one individual caring for 4 of your clients at all times. They are close enough to intervene if necessary. So they are close proximity of these individuals so they can respond to their needs. That's in general. But if you have specific cases, please feel welcome to talk to us and we'll be happy to answer.
Thank you, Simone. I appreciate that. All right. And we're about there to wrap up, but I'm gonna go ahead and Jamie, throw a question to you. Our support coordinators for DSPD still encouraged to use telehealth for visits and meetings unless health and safety cannot be reasonably determined without an in-person visit.
So we haven't changed our position in regard to virtual visits at this point. So definitely you want to assess the needs of the individual and the reason for the visit. But we'll make sure we anticipate discussing this and having plans in the future for how this needs to look. But for now, continue to do what you've been doing.
Thank you, Jamie. One second here, see if we've got any other questions coming in. All right, it looks like we have a question. Unfortunately, I'm not sure who is best to answer this, so it may be one we have to follow up with, but I'll throw it out there in case anyone does have information they can answer. It says, has there been any updates regarding the changes made to the Nursing Care Act that now allows our providers to provide many duties previously limited? Are any of you prepared to answer that on the call here from DHHS?
I am not familiar with the Nursing Act, but we'll have to, because we have other facilities that come from health and also use nurses in their programs. So it is an important topic for us to get familiar with. I am not very familiar with it right now, but we'll study it.
Perfect. Yes, and like Simone said, we don't have the answer. It looks like it's a DSPD question and that it has been updated on DOPL according to the chat. So we'll find out a little bit more information on that and we can send that in our follow-up email so that you all have the right resources on that. Apologize, we can't answer that. So thank you. That looks like kind of the end of our question and answer period on here. So I just wanted to thank everyone who joined us today for your questions, for your feedback. I know we dropped a lot of emails and links in the website or in the chat, so please feel free to reach out on that. Also wanted to remind you that you can submit questions anytime prior to these meetings. You don't have to wait for the quarterly meeting. The questions can be sent directly to the email dropped in the chat there. Also, if you want to send them in advance, it does help us prepare. So like the last question, we can answer those questions and we don't leave you hanging without an answer. Look for an email with the information about the next provider meeting. Like we said, that will be in the next quarter. Just want to thank everyone for attending today, for all that you do to provide services to children, youth, family, and individuals in the state of Utah. We know here at DHHS that we couldn't do it alone. Our providers provide the services and we are very grateful for all the work that you do. And I think the last few years have been, exceptional work for all of you. So thank you very much for joining us today and we will see you all in 3 months.